Everybody, I'm excited to welcome Dr. John Schmidt of Resolution Spine and Joint for the next in Aureum Physio Spotlight Series. Dr. Schmidt is dual board certified in physical medicine and rehabilitation and pain medicine. He has nearly a decade of experience helping patients throughout the triangle overcome spine, joint, and musculoskeletal pain. He completed advanced fellowship training in interventional spine and musculoskeletal medicine at the Medical University of South Carolina in Charleston, where he developed his expertise in precise, minimally invasive procedures and regenerative treatments. Together with Dr. Bai, Dr. Schmidt is a co-founder of Resolution Spine and Joint with a mission to raise the standard of care for spine and joint conditions across the triangle. Thank you, Dr. Schmidt, for joining me today and taking time out of your busy schedule. I'm excited to dive into collaborative patient care and highlight the great work that Resolution Spine and Joint is doing in the triangle. I alluded a little bit to the background of your education and training, but why don't you just give everybody a little bit more detail about your experience going through your residency training and your fellowship, and kind of what led you to being more interested in treating spine and joint pain conditions?
Sure. Well, thanks for having me, Heather. And I'm excited to the interview. But my background is in physical medicine and rehabilitation, which a lot of people have never heard of. And so most specialties are focused by organ. So if you have a heart problem, you go to a cardiovascular doctor. If you have a liver problem, you go to a GI doctor. We're unique in that we are really the function doctors. So as rehabilitation physicians, we can treat literally any part of the body, head to toe, but we do that from a perspective of trying to help our patients with independence and quality of life and mobility. But from a physician perspective, rather than from a physical therapist or an occupational therapist perspective. And so, what really drew me to rehabilitation was really the functional nature of it, that we're not necessarily trying to solve puzzles, as one of my kind of mentors said. I was for a while in between doing internal medicine and doing PM&R. And he said, if you want to solve puzzles, do internal medicine. If you want to solve problems, go to PM&R. And that really spoke to me that, we help patients walk further and get out of bed and play golf, run around on the floor with their grandkids, things that are important to them. And that really spoke to me. That's what drew me to rehab medicine, whether it's somebody in their late 30s who's just starting to get arthritis and can't walk 18 holes like they used to, or whether that's somebody, after a brain injury or a spinal cord injury who's trying to go back to work, or if that's somebody on the other side of life in their 80s or 90s or above who's just trying to stay in their home and maintain independence. And that's what drew me to PM&R. When it comes to kind of the interventional part of it in spine, I think it's much more hands-on approach than a lot of if you want to do pediatric rehab or spinal cord injury rehab or stroke rehab, you really spend a lot of your time in the hospital rounding, which wasn't my favorite thing to do. And I liked the long-term relationships with my patients that we had, because some people you see once or twice and they get better. Some people you see for the rest of their lives, but I like the outpatient side of it, and I like that it was more kind of hands-on and procedural based rather than a lot of meetings and notes in the hospital,
Mhm.
which is great. And so that's what kind of drew me to South Carolina for my fellowship and into our specialty that I do now.
Awesome. And what was the vision really with your experience and working in different scenarios? What kind of was the culmination really between you and Dr. Bai to come together to start Resolution Spine and Joint? Did you have any specific missions that you were trying to accomplish or fill any gaps in the medical care that you were maybe seeing in positions in the past that you're really trying to fill in and bring to the triangle to just be that, preferred provider to help people get back to things that they wanted to do and in terms of improving their quality of life?
Sure. And I think Dr. Bai and I were both in the area for several years, and we both saw some gaps in the medical system where the doctors were good, but the infrastructure was frustrating, and navigating that healthcare system was a challenge, even for intelligent, experienced patients. And we thought we could do it better. And so we kind of opened our own practice to start on our own.
Awesome. And you alluded a little bit to like, your preference was not necessarily in the hospital and rounding, but you really value the patient care that you experience more in the, office or clinic setting, where you can either maintain a solid relationship with patients over a period of time, or even those that you only see a few times and help them get better and move on. But how would you describe like your overall approach to patient care and pain management? In regards to, patients that come in that maybe have never experienced or to your point have heard of, physical medicine doctors, like how do you educate them about yourself and where is your approach to, kicking off with them and helping them on their journey towards, pain management or pain-free lifestyle?
Sure. And so I think for me, it really comes down to what their symptoms are and what the pain keeps them from doing. There are people who are in severe pain and are laying in bed. And, my goal is not necessarily for them to be pain-free, but still laying in bed. It's for them to be getting out and doing those things that are important to them, which for most people, it's work, it's time with their family, and it's some kind of recreational activity. So I have a lot of patients that want to play with their kids or grandkids or, run around at their kids' soccer game and they have to carry, four folding chairs and a cooler and God knows what else you got to, carry to these games, and their back or their knee or their hip makes it hard on them. I have plenty of patients that play sports of some kind that's limiting. And so I think the first part of it is that interview in the office visit to really dig down and figure out what's really going on here. And I think that's something that we really do a lot better than some other places is to really get to know the patient and figuring out what's truly the issue. Because one of the things we saw with kind of other practices in the area is a lot of people kind of have an algorithm, and you come out and you have sciatica, so you need an epidural injection, and you need an anti-inflammatory, and you need, gabapentin, and everybody gets the same exact thing. And those are reasonable treatment options, but everybody doesn't necessarily fit that mold. For example, the person who has acute sciatica and literally can't get out of bed, and their wedding is in 2 weeks, or their daughter's wedding is in 2 weeks, is not the same person as somebody who maybe has sciatica and the exact same medical diagnosis, but it really only bothers them when they play more than 18 holes of golf in a single day. And so, same medical diagnosis, same ICD-10 code if we have any other medical professionals following, but the way that, I'm going to get those people better is a little bit different. And so, somebody with kind of minor annoying symptoms, you can modify their activity. You could talk about bracing. You could talk about as needed medications or lidocaine patches. If they're going on a week-long golf trip to St. Andrews, sure, you could talk about an epidural injection or a steroid pack before they go to get them through the trip. If you're, and I've had this patient come in the office, if you're getting married, next weekend, a week and a half away, or your son or daughter's getting married, we're going to go kind of full court press in terms of doing everything we can to get them through that wedding and through that travel, but also try not to knock them out where they don't remember it. Because it's we can give people enough pain meds where they won't be hurting, but we also want to make them functional. And so I think that balance is very important, and it's something that we at Resolution Spine and Joint do very well.
Yeah. And I think sometimes like having the small or smaller offices, smaller practices can be a little bit more personal to patients, and we are able often to spend more time in like every patient appointment that we have and have a little bit more personalized care. For those patients that you have that are not like a full court press or, might be playing the long game towards more pain management, how do you, approach your way to keep them motivated? Because obviously with PT, where we don't have the access to being able to give like a quick turnaround to pain relief, trying to keep someone that's having either chronic pain or pain that's really inhibiting their quality of life stay positive and like move towards like a better outcome. Like, is there any way that you approach those patients that might have like chronic pain or just a really difficult diagnosis or situation to keep them staying on their plan of care, keep them on their trajectory that you want them to follow in terms of moving forward, staying active to get back to where they want to be or where they express their goals are without just, kind of like giving up or throwing in the towel or becoming completely reliant upon like any sort of like medicinal alternatives or anything like that.
So we certainly see a number of patients who get kind of frustrated and often lose hope. Some of our patients come to us after 5 or 10 years struggling with these issues, and some of them have been to, 4 or 5 other doctors. And, I'm not a miracle worker. I can't, lay my hands on somebody and totally fix their back. But I think what we do is, number one, kind of give them a reasonable expectation and a time frame of, you know, look, you've been dealing with this for 5 years. You've tried, 20 different medications. Let's take a look with fresh eyes and let's talk about some newer options that may not have been available even as recently as 5 years ago. If there's gaps in the things that they've tried, let's try things, but also not overpromise because I don't want to, tell somebody on the first visit, hey, you're going to be doing cartwheels on your way out of our office, and then they maybe do get better, but they're not as better as we led them to expect, and so they still come back frustrated. So I think kind of setting reasonable expectations and really kind of understanding the patient's reasonable goals. And if they're not reasonable goals, kind of addressing that, which
Or
requires a
adjust.
certain level of sensitivity.
Sure.
And some of our medications can take 6 or 8 weeks to work. And so I think telling them that up front of, hey, we're going to start this medication, but it's going to take you a month or two to see the full benefit helps them stay with it because it's very different than, something like ibuprofen or, where you take it and an hour later, often you're seeing a result already.
Right, right. Well, that kind of almost what you mentioned leads a little transition maybe into something that I wanted to talk about as well is, kind of regenerative type medicine, most specifically PRP, is that is probably the, trigger word that I hear a lot, like in my practice of patients asking me if I know what PRP is, should they use PRP, what is PRP, where can they use PRP, and other advanced procedures. So kind of if you can give us like a brief, like kind of description of what exactly PRP is, what, in your opinion, are the best things that PRP can be used for, and what like the ideal candidate for PRP is.
Sure. And so PRP stands for platelet-rich plasma. And so anytime the body has an injury, whether you cut your finger cooking dinner tonight or, have knee arthritis or kind of any other problem, your body has the ability to heal itself to a certain degree. If you cut your leg off, you're not regrowing another leg like a starfish, but, within reason, the body is capable of healing itself. And that occurs through kind of cellular signaling, which is driven by kind of nerve input and through kind of healing factors in the blood. And so the full answer is very complicated, but the kind of high level overview is what PRP is we draw the patient's blood, we put an IV in, we draw out a small amount, we put it in a centrifuge and spin it around, and that separates out different parts of the blood. But that lets us concentrate these healing factors that are in the plasma or the pure liquid part of the blood. And then we can inject that concentrated plasma with those healing factors into an area that's injured to try and help it regenerate and heal. And I would say it's most effective for conditions like arthritis, tendonitis, things that are relatively early on in the disease process. So somebody like, 30 to 50-year-old kind of weekend warrior athlete who kind of can't quite keep up on the soccer field or the basketball court or the golf course kind of the way they could 10 years ago and is starting to get it. That person is probably the ideal candidate for PRP.
Okay.
Where it's not works great is the 85-year-old person who has severe arthritis, but maybe has other medical problems where they're not a great candidate for something like a knee replacement. We
Hmm.
have other options to treat that person, but PRP wouldn't really make sense for them. It
Yeah.
has been studied for some other conditions in the spine, like disc wear and tear. But I would say the strongest research evidence is for kind of early structural injuries like joint arthritis, tendonitis, things like that in patients primarily under 50 or 55.
Okay.
It's safe to use in older folks, and I would have the conversation with anybody if they really wanted to try it. But most insurances don't cover it outside of a few very narrow indications, just because there are a lot of small research studies, but there aren't large research studies of hundreds of people. And so, the way the insurances work is insurance coverage is usually the last step in kind of getting new treatments widespread
Right.
integration.
Yeah. And like kind of to your point about some medications that take a while for it to set in and get the full effect, do you have any reasonable expectations? I know sometimes it could be dependent upon like what exactly you're treating, what the diagnosis is, but how long could people see a turnaround time and getting any sort of benefit if the benefit will occur with PRP?
Sure. So the first thing I tell people is the pain is going to get worse initially. And because PRP kind of stimulates the inflammatory process as kind of one of the steps in healing, usually the first couple of days after the injection, their pain's going to get worse. And so I tell people that because otherwise, they would be understandably upset if you go to the doctor because your knee's hurting and I give you a shot and then 2 days later it's worse. If I didn't tell you that, you'd be justifiably, pissed off at me.
Yeah.
So I tell people, I was like, you're going to hate me for a couple days,
Uh-huh.
but usually within, I would say 2 to 4 weeks, we'll start to see a significant improvement. It is a treatment that does require, a little bit more time to work. And so it is something that, the first couple weeks afterwards, I will have people scale back their activity a little bit just because, we don't want to try to kind of rehab this joint and let it recover and then go, run 10 miles and kind of irritate it. Scale back for the short term few weeks afterwards and then kind of let it do its thing and hopefully get back kind of into full activity and better activity tolerance.
And then how do you see that kind of integrating? Because I would say, from like a PT standpoint, I've had different situations where I've had patients have PRP and their physician has either been like, yeah, go back to PT and participate. And I've had another situation where we've had like a 2 week break in physical
Yeah,
therapy. And of course, I think some of it can scale to what level of intensity are we in like the rehab program and like what are we asking them to do or not
sure.
asking them to do. And like obviously any plan of care should and would be modified, but how do you approach kind of the interaction between PRP and something more like rehab versus,
Yeah.
obviously not having somebody go run 10 miles, but
Yeah.
do like more of like an ongoing plan of care from a PT standpoint?
Yeah. And so I think it really depends on what specifically you're doing in therapy. And I think that's one of the advantages that we at RSJ have is our background as rehab doctors. Like when you send me the PET plans of care, I actually look at them. And if there's adjustments, I'll make them. Whereas a lot of doctors just kind of blindly sign off. And
Right.
so it's not going to harm the patient to do whatever they want to do afterwards, but it might kind of limit the potential benefit of the PRP if they're doing really aggressive things. So somebody who, was rehabbing like an ACL sprain, not a complete tear in physical therapy and doing like isometric knee exercises or things like that, yeah, totally fine.
Yeah.
It's not going to stress the knee that much. Somebody who might have, another injury and for some reason was on a work hardening program where they're really trying to test their endurance and their limits, I would probably say that, okay, if that's what you're doing in PT, something very aggressive where you're lifting 50 pounds and, doing 50 squats or, to really test their limits, then I would say, okay, now's the time where we need to scale back. And that's something that a lot of physicians, I think, are kind of hot or cold on, or they don't appreciate the nuance. So, and it's easier to just say, sure, do whatever you want, or take 2 weeks off PT. But I think what we lose for the patient is kind of the potential to maximize that benefit by, doing as much kind of rehab as they can and not delaying their PT progress or their, return to sport or whatever, but also, not putting them at risk of kind of getting a reduced benefit from the PRP. So I think
Right.
that's really benefits from kind of communication between the physician and the physical therapist. And I think that's something that's great about your practice, Heather, is, it's easy to reach out and get you. I hope it's easy about our practice that if you were another referring doc or physical therapist, can reach out to me directly and get me and say, hey, I have a question about this patient. What'd you like to do? That I think is one of our strengths, specifically in our practice, but also a lot of smaller practices is that we are generally better at communication and certainly accessibility of the doctor versus, a big hospital-based practice or kind of private equity owned where there's kind of layers of bureaucracy that you have to go to actually get a hold of the doctor.
Yeah, and I would agree, and I do love that about RSJ. Is I, to your point, know that y'all are reading notes and want to have more information for any of our shared patients, which is wonderful because it is tough from a PT standpoint when we have patients that go back and have their follow-ups with their physician, and we send all the notes over, and then the patient has, kind of says like, oh, I don't think that, the physician even knows what I'm doing or what we're doing in
Right.
PT. So it can make that continuity of care and collaborative approach be a little bit more difficult when it seems like not everybody is informed about the current
Yeah.
state of the rehab phase. So, in addition to PRP, I know there's other regenerative type medicines, but is there anything, in this coming of age of ongoing research and technology development. Of course, like the hot topic these days is AI and how will AI change like patient care, patient interaction, treatment from things that you might be more excited about versus stressed about or worried about. Is there anything new kind of upcoming that y'all see on your end from either pain management standpoint, chronic pain, spinal pain, or joint pain that is not PRP, but is something that is showing promise for helping people out in terms of any of the conditions that they may be dealing with?
So I think there are a number of treatments that are available, and they're really limited more by insurance coverage, honestly, than by kind of medical research. And PRP is one of them where, it's effective, it's well studied for a handful of indications, it's safe for a lot more, uh, but it's almost never covered by insurance. And so I think most practices charge kind of between $500 and $2,000 for PRP, depending on kind of the practice and also where it goes. So, if we're injecting PRP, right around somebody's spinal cord, that's a lot more risky and complicated and time consuming than if we're injecting PRP into the soft tissue for something like tennis elbow.
Mm-hmm.
But there's a lot of people out there who would benefit from it who don't have, $1,000, cash that they can kind of pay for these things. And so there are a number of other treatments available for, spine and joint conditions, whether it's, we talked about kind of the middle-aged weekend warrior with knee pain, PRP is a great option. We talk about the, 85-year-old with a lot of chronic medical conditions that might limit their options for something like a knee replacement. We have procedures where we can do kind of what's called radiofrequency ablation, where we can deactivate the sensory nerve to the knee. And so for people with severe arthritis, it's a great non-surgical option. Unfortunately, insurance, most of them don't cover it. There is a newer vascular embolization that's been studied in the knee, which looks very promising for patients with inflammatory conditions like rheumatoid arthritis. Same thing, insurance doesn't cover it. And it's part of the life cycle of new medical treatments is usually there's some limited research studies and then kind of they're sponsored by a drug company and then there's kind of bigger research studies that are sponsored by, grant money or, other federal funding. And then when there's kind of enough studies that we're all convinced that it's relatively safe, eventually insurance will cover it. But I think a lot of the things that I see on a daily basis are more limited by kind of cost and insurance coverage than by, technology available.
Yeah. What would you say though, I guess with stuff that has been around for a while and from like the start of your career to now, is there anything that's changed significantly in how you approach musculoskeletal pain or pain management? Anything that's evolved significantly over the last few years?
Yeah, I mean, I think there's, in terms of diagnosis, AI has been a huge thing that is really even within the last probably 2 years has changed, and I think will continue to change over the next 5 to 10 years. I've heard people say it's going to be bigger than the internet was, 20, 30 years ago. And I think that's probably the biggest thing that I have seen change and the biggest change that I would expect going forward. Uh, because we literally for, I don't know, $25 a month, I think for ChatGPT, it may be more or less for other AI programs. We literally have the knowledge of humanity at our fingertips
Right.
and readily accessible. But I think the challenge is implementing it. And I don't know if you've used AI very much. I've used it, I would say a moderate amount, but it's very good at accessing information, but it's not very good at kind of teasing out what you really want. And it's not necessarily very good at kind of customer service. Uh,
Right.
and we have the option within our medical record software and our phones of having kind of an AI answering service, and patients don't like it. They
Yeah.
want a real person on the phone. And I think it's going to emphasize kind of the doctor-patient relationship or the physical therapist-patient relationship or the, nurse-patient relationship in the future. Because I think people use Google search a lot more, maybe less than the last 2 years because they're using AI now. But,
Hmm.
like when I first graduated med school and was in residency, I didn't see a lot of Dr. Google stuff. People would come in and say, this is what my problem is. And you say, okay, we're going to run these tests. We have a diagnosis. We're going to treat you. And they'd say, okay. Or
Yeah.
they might say, well, my sister had this problem. She had this treatment and it worked really well. What about that? But I would say kind of once I finished training several years later, up until probably a year or two ago when it shifted to AI, people would say, well, I did a Google search and I found this. What about this? And a great example is with the ablations, where we can do ablations for sensory nerves only. So areas like the knee, areas like joints in the back. We can't do ablations for nerves that control muscles, or else you're going to have muscle weakness. And I've had a number more people than I can count over the years ask, well, Google says an ablation can help my back pain. And for people with spinal stenosis or sciatica, it could help your back pain, but it could also make your leg useless. So, not
Right.
a safe treatment option for some things. And I think AI is getting better, but I think we've seen a lot of insurance companies are offering telemedicine visits with sometimes it's a doctor, sometimes it's a nurse practitioner or a physician assistant or a physician associates. I think they changed the name now. Within the next 5 to 10 years, I think we're going to see televisits with some kind of AI person, whether it's a text chat bot, whether it's, they have AI actresses now. I think Tilly Norwood, is her name, and they had some kind of music video that came out within the last year. I think we're going to see AI physicians,
Yeah.
and they're going to be probably programmed to be excellent, customer service people. If it's like anything, with ChatGPT, it'll give you exactly what you ask for, but it may not be what you really need. And so I think it underscores the importance of the kind of doctor-patient relationship and the customer service that we can provide because almost certainly it'll be cheaper for somebody to see an AI kind of provider rather than a real live person. But I'm confident that as a, real live skilled physician, that we can provide better care and certainly better customized care to an individual than at least today's AI. Who knows
Yeah.
10 years from now?
I would agree. I've had several patients come in that have Chat GPT or use their AI bot of choice with printed off their own exercise routine for
Yeah.
whatever, diagnosis they've been given. And to that point, they're like, well, I've tried this and it either makes me feel worse or I don't feel any different. And I've been working on it for 2 weeks. And I do think the real miss there is the AI is not taking into account different nuances that you can make to each exercise or how you program exactly, how you're putting them in. So I kind of have seen the same thing where either people have, like either been coming in with their diagnosis before I even see them, if it's like a
Yeah.
direct access relationship, or if they've seen a physician, been given a script with a certain diagnosis, then they're bringing me in their PT exercises
Yeah.
from the internet, which I think serves potentially a purpose, but it does, it highlights and underscores the misses that I've seen from that AI relationship for trying to create a plan of care from a medical perspective, the nuanced components of patient personality, patient expectations, patient
Yeah.
motivation that really is highlighted when they do have that interpersonal relationship with either the PT and themselves, and especially between the PT, the physician, and the whole team kind of
Yeah.
all working together to get that patient better. Looking ahead, what are y'all's goals for RSJ? You're what, relatively a year-ish in? Like, how do you see like RSJ growing and serving a bit bigger impact on the Triangle or, the North Carolina state as a whole?
Yeah, so we're about 7 months in actually, and we're already growing. I think what I have enjoyed the most in the past 7 months and what I look forward to the most is kind of the ownership that I get in terms of an autonomy that I get in terms of being able to kind of practice medicine on my own terms. Whereas anytime you have a boss, that person can tell you what to do, whether it's, uh, you know, 5 levels of your bureaucracy if you work at a big healthcare system, or if you work in a, smaller private practice, you may have only 1 or 2 layers of administrators, but those people's priorities generally is making as much money as possible. And sometimes patient satisfaction scores, metrics in terms of kind of things that on paper are supposed to be good, but may not, reflect the individual patient's, desire. I've never seen or heard any physician in any specialty say that they were graded on how well they got the patient back to activities that were important to them. It's usually how much money are you bringing in? What are your Press Ganey or patient satisfaction scores? It's how many nursing complaints have you had or not had? How well does the other staff like you? And those things are important. But I think, and as a private practice owner, they're probably even more important to me now than they were then. Because as an employee, I got a paycheck, and I got that worst case kind of my ears been about me taking too long in clinic some days. But as an owner, if money's not coming in, staff are not getting paid. And so I
Right,
think it's even, those things are even more important now. But the difference is, we have the flexibility to, work somebody in when need be, even if the schedule is already kind of full. We have the flexibility to, you know, do, charity care for somebody if we have to without going through kind of chains of bureaucracy. We have the flexibility to, adapt new technology quickly, without having to go through 3 months of committee meetings and overviews and things like that. And I think that's what I'm the most excited about is kind of the adaptability going forward of kind of letting RSJ evolve kind of to meet the needs of our area.
awesome. And what would you say is the most rewarding part of your job?
Seeing patients get better and get back to activities that they enjoy. So, I had a patient this week that just came back from their child's wedding, which was out of town, and they were really nervous about it. And they said, "You know what, doc? Like I wasn't perfect, but I was able to get through it and enjoy it and, dance with my daughter on her wedding day, and that made all the difference." And
That's
so that type of thing is what really gives me the most joy in my practice is
awesome. That's wonderful. And just give us kind of like a typical day in your life. Well, what do you like to do, either like outside of the office or family life?
sure. So I have a 10-month-old, almost 11-month-old at home. So he consumes most of my free time with diaper changes and feeds and playing. He likes to His name's AJ, and we joke that it's AJ Zilla. We put him on my shoulders and ride around and make dinosaur noises, and he loves it. But yeah, so that is, for those of you at home that have kids,
Yeah.
a lot of work.
Yeah.
But,
So you got a
what
business
I'm,
baby and a real baby.
that's right.
Yeah.
And so my available free time has gone down a lot in the last year, but I do a lot of DIY stuff around the house. Right now, we're in the baby proofing phase where we're getting up all the, baby gates and stuff that we didn't need, but he's about to start walking, so he's a lot more mobile. I like to ski and play golf and scuba dive when time allows. So we went on our first airplane trip with a baby recently, and I can tell you it's a lot more work. But it's fun, and
That's
so
awesome.
we got thankfully a full life outside of work, as well as a full life kind of getting RSJ set up here.
That's amazing. Anything about RSJ that we haven't covered or that you would like any potential patients or referral partners to know?
Yeah, I think we've covered the basics, but we really are pretty full scope uh, in terms of anything that doesn't need an operating room. If it's bothering you and kind of limiting activities that you enjoy, we're happy to see you. We don't treat everything. And so sometimes we have patients that come in and we kind of look at them and do a workup and realize it's not really a spine or a joint problem. For example, we had one patient that had an inflammatory disease that needed a rheumatologist, or if they have an underlying neurologic condition that we can't treat, uh, we can pass them along to kind of the next person if it's either something that we can diagnose but can't treat, or if it's something that we're stumped but we need to kind of send you to somebody with a little different expertise. We can do that, but we're happy to see whoever. I think the one thing that we really don't treat is people with kind of pain medicine addiction. Just because as a small clinic, we don't have the resources to really treat those people. They really need a team approach with, a physician prescribing medications and a psychologist and a whole kind of team of folks. But,
Sure.
most other things, and even, if somebody has addiction issues, we can see them, but pretty quickly we're going to kind of get them into somebody that can really help them.
Perfect. And then we're almost perfectly on time or out of time, I guess I'll say, but would you say you are more of a coffee or a tea person?
Well, since the baby, I'm definitely more of a coffee person. I think I've had more coffee in the past 10 months than I did the whole life prior.
And then on that note, how do you take your coffee?
With enough sugar that it doesn't taste like coffee and a little bit of cream.
Sugar water with a little
Yeah.
caffeine.
Yeah, I didn't grow up
Uh,
drinking coffee, so I got to put enough stuff in there that it only barely tastes like coffee.
Masks the taste.
Yep.
Well, Dr. Schmidt, thank you so much again for joining me today. I know it asks a lot to take 45 minutes out of your schedule when there's a lot of, I know, like charting, clinical care, good patient care, and teamwork that you go through day to day. I appreciate your insights, your education to me, education to everybody listening and watching this. And then also just your commitment to helping our patients in the triangle get better and move towards a collaborative approach. If people want to learn more about resolution spine and joint, is it best to just send them to your website and they can get connected through your office line?
Yeah, so if they want to visit, they can call. We're, I think, in the process of, figuring out how to make kind of people be able to self-schedule online without it being total chaos.
Yeah.
But we can certainly, if they want to just learn about us, the website's great. To my knowledge, we're the only, resolution spine related people in the area. I think there's like a resolution chiropractor in Arizona or Utah somewhere, but we're the only one in North Carolina that I was able to find. So if you just search for, Resolution Spine, you should find us. And yeah, we're happy to see whoever. It's pretty easy to get in, and we take almost every major insurance now.
Okay, okay, awesome. Well, thank you so much. All right. Well, that's everything. Thank you so much for your time. I really, really appreciate it.
All right. Thanks, Heather. Have a great
Yeah.
day.